Hi, I'm Broders. I'm a Senior Project Manager with Yellowbrick Consulting. Thank you for joining us for this installment of our Simplifying the Complex video series. I'm here with Jeff Agner to talk about what it takes to set up a healthcare facility, a process often referred to as the fit-up period. Jeff is the Director of Transition and Activation Planning at Yellowbrick and has spent the past 15 years advising clients across the country on the fit-up of their new spaces. Welcome, Jeff.
I'm happy to be here, Ali.
Can you tell us a little bit about the fit-up period?
I'd be happy to. So the fit-up period, sometimes referred to as the startup or load-in period. If you're opening a military facility or a government building, they like to use the term initial outfitting. But really what we're talking about here is the point between construction being substantially complete and day one of opening the facility for operations. And so that period for most projects is about 3 to 4 months. For some of the larger, more complex projects, you might see that being 6 months or longer. And so that's really the time to take the building from the contractor and turn it into a healthcare facility.
It sounds like a lot of activity occurring during that time frame. Can you paint us a picture of what we would expect to see inside the building during the fit-up period?
Yes, and so at this point, the building is complete as a building. It's got paint, it's got most of the furnishing and fixtures in place, but it's not yet ready to open operations. And so this is the time where the furniture team will come in and start putting the tabletops and kind of more movable items in the space. Even task chairs and the like will start to come in at this time. Shortly after the desktops are in place, you have the technology team coming in. So that group is going to be placing the desktop devices, configuring the different systems and IT equipment that's in the building. Also making way for biomed and clinical engineering and others who are going to either attach to the network or have medical equipment to deploy. That medical equipment will also have accessories and other things required to make it work. And so, all those hospital groups are in, at the early part of that period. Towards the end of that fit-up period is when we would see teams from materials management and supply chain starting to put the initial stock and product out on the floors, and representatives from the departments would be in their space preparing it for day one. So they're configuring their workspace, they're labeling shelves, really making sure that the space is comfortable and safe for patients.
It seems there are many moving pieces that need to come together in a fairly short period of time. I expect there is a lot of pressure to complete that work as quickly as possible so that the facility can open.
Yes, there's a tremendous amount of pressure. As you can imagine, some of the unknowns with the delivery of the project might extend that delivery date a little bit later. So, for example, right now with the pandemic and some of the challenges to the supply chain and the labor on projects, we've seen construction delivery dates delayed. And so when the organization has already made commitments to their stakeholders, the outside community and their patients and providers and others that this is when we're going to open, and you have to hold that fixed, you then find yourself having to compress that fit period to be able to do the same amount of work, all those activities we talked about, in a much shorter period of time.
So whatever the reason for the compression of the fit-up window, how should organizations plan for and mitigate that risk to ensure a smooth and timely opening of the new facility?
Yes, and so definitely having a plan B is important. And in many cases, you can imagine a plan C and a plan D may even be needed just given all of the unknowns that could happen. One of the ways that we recommend mitigating some of the challenges with this compressed fit-up window is to start with early and frequent communication. And so not only about the building's go-live date, but also about what the building might have when it opens for day one. So about a year out, we recommend that the organization still use the general season to communicate that opening window. As we get closer, you can start to refine that to be in a particular month. And then about 6 months out, when you have pretty high confidence that everything is going the way it's expected, then you can pin down an actual move date and communicate that with regulatory agencies and others that need to know exactly when that first patient will be seen in the new space. So one strategy is that communication part. Also, just managing and having have honest conversations among healthcare leadership to say, what services could we open without? And for example, if you had an imaging suite that wasn't quite ready, and was kind of that last part of the construction project. But you can still open safely for patients without that. You might find that an organization will still elect to open for patients, move patients if they're doing that, or open their doors for that first round of patients, with some of those areas still not complete. And so some point after opening, the team would circle back and activate that last piece, or pieces that weren't quite ready when the building was open. So again, ways to still meet that target date to the community, but also manage the realities of certain things possibly being behind from the construction side.
Thank you very much, Jeff, and thank you all for joining us today.